Good day and welcome everyone, and thank you for joining us on today's webinar. My name is Karina Bates and I'll be moderating today's online session. Before we start, we're just going to do a quick sound and visual check to ensure that you're all able to see the slides and that you're also able to hear our voices. So first we're going to do a quick audio check. If you can hear my voice, if you can please click the raise hand button, and the raise hand button can be found on the side tab near the top of your GoToWebinar panel. And I'll give you all a few seconds to do this. It looks like everybody's putting up their hands. Thank you very much. Awesome. Oh, what a great audience you are. Thank you. Okay, I'm going to lower those. And now we will go do a quick visual check as well. And again, if you're able to see this visual test screen, if you can again click that little raise hand button, which is located on the side tab near the top of your GoToWebinar panel. And again, I'll give you all a few seconds to do this. And oh, you guys are rock stars. You can see the screen and you can hear my voice. So everybody's put up their hands. Thank you very much. Now, if for any reason you can hear my voice, but you're not able to see the slides, or if you're having any other difficulties with the audio or visuals, please contact GoToMeeting's support and help site. And the website is support.citrixonline.com/GoToMeeting. And you can reference the webinar ID number, which is 106-348-035. Okay, I will lower those hands and thank you all for helping us with that audio-visual test. And I officially welcome you to our webinar session today entitled E-Prescribing and Medication Management, What Your Dental Organization Should Know About EPCS. And we thank you all for taking time out of your busy schedules to join us today. And we promise to make good use of your time, so let's get started. And I will be your webinar moderator today. My name is Karina Bates, and I specialize in making these webinar events come to life at the XN Group. Now, if at any time during today's webinar you have questions, please feel free to post them using the questions pane on your GoToWebinar panel. Simply type your query in the questions box and then click send. And we will be monitoring your questions, and we plan to reserve time at the end of the webinar session today to answer as many as we can. And for taking the time to join us today, you will all receive a copy of a brand new white paper authored by Dr. First, entitled The Evolving EPCS Landscape, a Prescription for Stopping Opioid Abuse. And published last month in March 2016, the white paper highlights EPCS trends and advances in 2015, including the contrasting realities of rapidly increasing EPCS enablement on the part of pharmacies and the disproportionately low rate of EPCS adoption among the nation's providers. And we'll also send you a link to a recording of today's webinar that you can download should you want to share it with some of your other colleagues. So look for an email in your inbox shortly after today's session with this information. And today's webinar is brought to you by Axiom ERX. Axiom ERX allows for electronic prescribing and streamlines the prescription process by combining the searching, the documenting, and the writing out of prescriptions into one simple automated procedure. And Axiom ERX is powered by Arcopia, which is Dr. First's standalone drug e-prescribing solution with integrated medication history, formulary, drug interaction, and medication adherence functionality. It's my pleasure to introduce our guest speaker from Dr. First. Mary Harp is the channel manager of the Partners Division at Dr. First. And Mary works with my colleagues here at the XN Group to deliver an integrated e-prescribing solution in Axiom. And she joins us today as a co-presenter on today's webinar. So welcome, Mary.
Thank you so much, Karina. I appreciate the opportunity.
And thank you, Mary, for joining us on today's webinar. And our next presenter today is Kuljit Gandhi. Kuljit is our EHR specialist here at the XN Group, and she's worked with several Axiom clients from universities to teaching hospitals and colleges. And she joins us today to co-present with Mary, and she's going to begin today's session. So thank you for joining us, Kuljit, and welcome.
Thanks, Karina. Welcome everyone to our live webinar. Karina mentioned my name's Kuljit, and I'm very excited to be doing this presentation today with Mary. So let's get started without any further ado. So first we'll give you an overview of today's agenda. I'm going to introduce you to e-prescribing and its benefits, with a brief explanation of the difference between the e-prescribing of controlled and non-controlled or legend substances. Then I'll briefly discuss the opioid addiction crisis in the US, which has actually practically justified the practice of e-prescribing. And then Mary is going to give you an overview of EPCS and why it's important to your dental organization. And she's going to be using now New York State's iStop program as an example. I'll then demonstrate a typical e-prescribing scenario using Axiom ERX. So you'll get ready to see a live demonstration with the focus on the process of the controlled substance prescribing. And we are going to pause a couple of times during today's session to poll the audience and get some feedback from you. So please don't fall asleep on me. And finally, at the end of the webinar, we're going to have a little Q&A session to answer any questions that you might have that you've submitted during the webinar. So to begin, let's briefly describe the differences between e-prescribing of controlled and non-controlled or legend substances. So for the purposes of this webinar, we're going to distinguish the two as follows. So both controlled and non-controlled or legend substances are drugs or medicines that require a dentist's prescription before a patient can acquire them. But the big difference is that controlled substances are usually narcotics and stimulants that are considered high potential for abuse. And they require additional authentication when a dentist prescribes them to a patient. So some examples are Vicodin, Demerol, and Norco. Whereas non-controlled substances, on the other hand, are not considered as high risk for potential abuse, and therefore they don't require additional authentication when prescribing. So examples of these drugs are amoxicillin, Clinpro 5000, which requires a prescription, and ibuprofen with a higher dosage, such as 800 milligrams, that you can't get over the counter, but you need a prescription for. Now, the opioid addiction crisis has captured the nation's attention. We all know this, that more than 15 million people in the US abuse prescription drugs regularly, and 52 million Americans over the age of 12 have used prescription drugs and non-medically in their lifetime. And each day, 44 people in the United States die from an overdose of a prescription painkiller. Now, drug overdoses are now the leading cause of death from injury in the US. So it really comes as no surprise that the US Centers for Disease Control has declared prescription painkiller abuse a national crisis. This crisis has brought together legislators, law enforcement officials, and healthcare leaders to debate effective solutions that aim to reduce the unnecessary or excessive opioid prescriptions, prevent fraud, abuse, overdue deaths, doctor shopping, and drug diversion. One solution that may prove invaluable in helping to mitigate this crisis is EPCS, so the electronic prescribing of controlled substances. So today, state-level legalization in all 50 states and DC has been achieved, putting laws in place to allow EPCS to help curb drug abuse and misuse. And Mary is going to discuss this later in more depth. And now, like I mentioned before, I'm going to take a quick pause for an audience poll. I'm going to ask Karina to queue up the question so you can see it on your screen. And the question is, does your organization currently use an electronic prescribing solution for non-controlled or controlled substances? And then we have a number of options for you to choose from, whether you use ERX, Axiom ERX for e-prescribing, a different solution for e-prescribing. If you don't use e-prescribing at all, or if you're unsure or don't know, you can select that option. So we'll give you a few more seconds to make your choices, and then we'll share the poll results with you.
Okay, thank you, Kuljit. I'll give everybody a couple more seconds just to finish answering. It looks like we have most people who have voted, so great. Okay, what I'm going to do is I'm just going to close that, and then I'm going to share that with you so that you're all able to see on the screen the answers. Oh, look at that. So the answers that we got here are, we have 41% of the audience saying that yes, they do use Axiom ERX for e-prescribing. We don't have anybody that's using another e-prescribing solution, and the remaining 59% saying no, we do not currently use an e-prescribing solution. Okay, I'm just going to hide that. We will go back to the slides. And thank you all for participating in that poll. And what we're going to do now is I'm going to hand the mic over to Mary from Dr. First, and she's going to talk a little bit more about e-prescribing and EPCS.
Thank you, Karina, and hello, everyone. There are actually many benefits to e-prescribing, and generally speaking, it increases practice efficiency and improves healthcare quality. And here's some examples. With the increasing volume of medications and the growing complexity of patients' medical needs, there's an increased risk of errors and adverse drug events. E-prescribing can improve patient safety and quality of care through a variety of mechanisms which reduce illegible prescriptions and reduce oral miscommunication. The implementation of warning and alert systems at the point of prescribing reduce those adverse drug interactions and give the provider access to the patient's medication history. The implementation of an e-prescribing system can reduce the time spent on pharmacy callbacks, faxing prescriptions to pharmacies, and automating the prescription renewal request and authorization process. It's estimated that in an average physician office, e-prescribing can save up to $20 million annually. E-prescribing can help decrease the number of unfilled prescriptions by removing one step in the prescription filling process, that of delivering the prescription and waiting for it to be filled. E-prescribing also builds a more complete medication history from all the pharmacies and physicians a patient may use. This can then be transmitted back to prescribers to help them evaluate and focus on issues with patient medication compliance. E-prescribing can also produce direct cost savings both for the patient and insurers. Many pharmacy benefit managers, or PBMs, or insurers provide detailed information concerning their formularies and the benefits structure of the patient's plan, and by providing this information to providers at the point of care, it allows identification of what medications are on the formulary and encourages an increased use of generic medications or other lower cost therapeutically equivalent medications specifically for the patient. An integrated ERX functionality allows you to accomplish all of this with really no extra workflow steps, because we pass much of the information needed between the EHR and the e-prescribing function. This webinar is aimed at specifically discussing e-prescribing of controlled substances, or EPCS. Why is this important to you? EPCS allows providers to leverage the same advantages and workflows for controlled substance prescriptions as you do for legend substances. Next, EPCS allows you to prevent fraud and abuse. Because of the protections provided by electronic prescribing, it's much easier to secure these transactions. And by not using paper prescription pads for these transactions, you're actually playing a key role in combating abuse and fraud. by using medication history, maintaining all files electronically, as well as following your state's regulations for accessing prescription drug monitoring programs, or PMPs, you'll play an active role in determining the number of prescriptions a patient has had for a specific drug. And then you're better able to detect doctor shoppers and deter that fraud and abuse. And lastly, it allows you to meet meaningful use requirements if your organization qualifies for Medicare or Medicaid incentives. Axiom ERX is integrated with Dr. First's industry-leading Arcopia e-prescribing application. So whether you're currently working with the e-prescribing portion of Axiom or you're considering adding e-prescribing, you should really know that Dr. First is an industry leader. And through our platform, 80 million e-scripts are processed annually, touching over 20 million patients. We serve over 71,000 physicians in the U.S. and are the chosen partner for over 750 hospital clients and 335 EHR vendors. And although e-prescribing is the core functionality for which we're known, Dr. First is also an innovator. Dr. First was the first to offer electronic prescribing of controlled substances and was the sole participant in the DEA's pilot project for EPCS in Massachusetts. This year, we launched the industry's first real-time benefit check application, piloting the capability directly with Humana, with additional insurers sure to follow. And we have an entire suite of medication adherence tools made available in Arcopia at no additional cost to you. EPCS became legal in the U.S. at the federal level on June 1st of 2010. This was the date that the DEA interim final rule was released. This rule specifically addresses the rules under which the DEA would allow pharmacies to receive and dispense electronic prescriptions for controlled substances, and the controls to ensure that only providers would have access to send these prescriptions. But, as these are the United States, this federal law was subject to each state's additional laws and regulations. 5 years after the passage at the federal level, in mid-2015, e-prescribing of controlled substances finally became legal in all 50 states. Dr. First's EPCS Gold 2.0 product meets all of the DEA guidelines and is already an integrated capability in Axiom ERX. It is directly based on the experience from the pilot program in Massachusetts. It is, as I've mentioned before, the first DEA-compliant EPCS solution, and it's currently being used by over 150 EHR vendors and over 20,000 providers in the U.S. With EPCS Gold, Axiom ERX can help you create one single workflow for all e-prescribing of legend and controlled substances, and it helps you play your part in the fight against fraud and abuse of controlled substances. Very importantly, it also helps you protect your license as state and federal law enforcement officials work to fight the opioid epidemic in the United States. Like the Legend ePrescribing tool, EPCS Gold offers real-time prescription monitoring. It helps you to increase prescription fill rates by up to 20%, gives you instant access to medication history. It also includes a robust set of clinical and formulary alerts to help you manage the safety and the cost of prescription medications for your patients. And Dr. First offers the ability to perform electronic prior authorizations for medications and a suite of adherence support tools. Now, states are beginning to add a lot in the way of legislation requiring physicians and pharmacists to utilize electronic controls, but some states have been much more aggressive than others in their efforts to curb the abuse of controlled substances. And as you probably already know, in August of 2013, New York State began adhering to its landmark Internet System for Tracking Overprescribing Act, or ISTOP. New York's ISTOP law has two parts. First, it requires that physicians check the Prescription Drug Monitoring Database, or PMP, prior to prescribing Schedules 2, 3, and 4 substances. And as of March 27, 2016, just about a month ago, it mandated e-prescribing for all prescription medications. Many states already have requirements for physicians to check their state PMP prior to prescribing, and many others are joining in. In fact, we expect several more states to follow New York's lead in the coming months and require the e-prescribing of controlled substances. Just last week, Maine followed suit by announcing an act to prevent opiate abuse by strengthening the Controlled Substances Prescription Monitoring Program. This includes a number of provisions designed to reduce overprescribing of opioids. In addition to the EPCS requirement, which goes into effect July 1st, 2017, this legislation also has provisions that limit the durations and the doses of opioid prescriptions. It also requires that prescribers receive continuing medical education on addiction. I think we're going to hear from a lot more states in the coming months now that iStop has gone into effect. So many of you are probably interested, perhaps a little concerned about what the DEA has in store for you, specifically in terms of requiring you to become identity proofed in order to prescribe controlled substances electronically. So let's just talk through that process. The DEA does have some pretty specific procedures and processes through which you must go in order to be identity proofed, and in this case with Axiom ERX, we're going to be using a remote identity proofing process. So you're only going to go through this one time, please keep that in mind, and after you go through this, you'll simply use the credentials that you bind to your identity or 2 factors of authentication to prove that you are who you say you are and send that script. So specifically, the DEA requires that each physician complete identity proofing to a National Institute of Standards and Technology Level of Assurance 3. Specifically, this means that the physician must be challenged with financial information questions, a process very similar to what is used when you get your free credit report. Dr. First uses Experian for this process, and in that way you can be assured of the integrity and the safety of the system. And I want to definitely point out that even though you're going to be asked for and challenged with financial information, for example, we're going to recommend that in the process you put in your personal credit card. Your card is not going to be charged, and only Experian has access to any of this financial information. Neither Dr. First nor Exan have any access to this data either before, during, or after this identity proofing process. And they already have the information anyway. So. The DEA also states that you must have in place what is called logical access control. And this just specifically means that the physician who's going through identity proofing cannot also be the person who grants that physician access in your local system. So it means you have to have a separate person in your practice to grant physicians access to EPCS. And then finally, the DEA states that 2-factor authentication is required to sign off on the controlled substance prescriptions. This simply means that you have to have 2 of the following: something you know, something you have, or something you are. This system protects the practitioner from misuse of his or her credential by insiders, as well as protecting him or her from external threats because the practitioner can retain control of a biometric or hard token. Authentication based only on knowledge factors is easily subverted because this can be observed, guessed, or hacked, and can be used without the practitioner's knowledge. For the Axiom ERX system, we use a passphrase, or something you know, and a hard or soft token, something that you have. This token generates random numbers that change every 30 seconds, and you simply input this 6-digit number into the system in addition to the passphrase to sign off on your controlled substances. And Kuljit will actually be demoing this for you in just a bit. The entire process, as I mentioned, is defined by the DEA and is as follows. First, you're going to receive or download a token from Exan because you'll need this for the Experian IDP process. You're then going to receive an email invitation to start the Experian remote identity proofing process. This process only takes about 15 minutes total time, but it has to be done by the provider themselves. And as I mentioned before, it's very similar to getting your free credit report. You're going to enter some demographic and financial data, and then you're going to be challenged with 3 or 4 questions to verify your identity, and these questions will be financial in nature. Just after you complete this identity proofing, you're going to take those tokens you've been either downloaded or sent, and you're going to bind them to your identity. After the identity proofing, Experian will send a letter to your home address and an email to your email inbox. And this letter that gets sent to your home will have a code, and you'll use the email to type in the code to that web link. After that is when you complete the LAC, or Logical Access Control. You'll let your practice administrator know that you completed the process, and they will grant you access to EPCS in the system. The entire process takes most users only about 20 minutes of total time, but as you can see, there are many steps that are necessary in order to prevent fraud in the system. I would recommend that you plan for the process to take about 1 to 2 weeks from start to finish, because that leaves you a little room for correction if any errors occur in the process, and make sure that you get what you need in time. As I mentioned before, once you complete this process one time, prescribing is largely the same as you're doing for Legend drugs. If you're prescribing a controlled substance, at the end of that process, you'll simply enter these 2 factors of authentication, your passphrase and your token information, prior to sending the prescription. So let's pause and take another poll. Karina, will you queue up the question for us so we can see it? Great. And the question is, do you know if your state is currently considering legislation to mandate e-prescribing? And you can choose either yes, my state is considering this, no, they're not, or if you're not sure or don't know, you can select that as an answer. And we'll give you a few seconds to make those choices. And then Karina is going to share the poll results with you.
Thank you, Mary, and thanks everybody. It looks like a few more people are answering, so I'll give you a couple more seconds to answer. I did have a couple of questions. Some folks wanted to know actually how many people were on today's webinar. So we actually have 44 people that are logged in and listening today. So just so you have an idea of what that means in numbers in terms of the poll results. So it looks like everyone's finished, so I'm going to close that, and what I'll do is I'll share that with you. You should be able to see the results up on the screen now. So the answer to the question, do you know if your state is currently considering legislation to mandate e-prescribing? It looks like 18% of the audience has said yes, they're aware that their state is considering mandating e-prescribing of controlled substances. Right now, we have about 12% of you that said no, and then looks like a majority of people at this point in time are not sure, don't know, or are unsure. So what we're going to do now is I'm going to close that up, and we're going to go to the next slide, and Kajit is going to do a demo of Axiom Storage. She's talking to me at the same time, so I apologize. I just lost my train of thought. Kajit is going to present a live demonstration of Axiom ERX. So I'm going to hand the microphone back over to her. So.
All right, thanks, Karina, and also thank you, Mary, for the portion of the presentation. It was very informative. So just bear with me one moment while I pull up my Axiom for you guys, and I'll show you e-prescribing using Axiom ERX. Is it changed? Perfect, and I just confirmed that everyone can see my screen now. Now for Axiom ERX, you would access the Dr. First or Copia engine, which we call Axiom ERX, through the EHR on the Medications tab. So now, just to give you a summary, we've got the Medications tab, and right now it's defaulted to show current only. I'm using a patient that we haven't actually already prescribed for in ERX, just so I can show you a few of the checks that you set up, and that will bring information into Axiom for you, just a little bit of the process. This is going to be a very high level overview that's going to kind of show you the two different methods of prescribing, and I'll show you with an example with both legend drugs and with controlled substances, and just to show you the differences between them, but we won't be going in depth of all the features of ERX for this webinar here. So you simply click the add record icon, which is on the right hand side. It is the plus button here. And when you click on that, you'll have a number of options. Now, the one we want to select is Axiom ERX, and it's going to connect to ERX. Now, keeping in mind you do require a internet connection for this because it is using the Dr. First Copia system, and it does pull information from within a larger drug database. So you need that in order to be sending. It is powered by the SureScripts network as well, and that's where you get the benefits of being able to see medication history reports. So you'll notice on the screen we have a little bit of information on the top here on the left. We can see the patient information, and this is pulling from within Axiom, the information we have on file. And the first thing that the ERX is going to ask you for is you see it says that you must first enter allergy information. Now, keeping in mind that if you did have allergies already in the alert box in Axiom as well, they would come over and they'd ask you to match them with the ones they have in the ERX system so that all information is accurate. But in this case, I don't have anything set up for this patient, so I'm going to come in here and I'm going to add maybe one pretty common allergy to show you the interaction checks as well. So I'm going to say that they do have an allergy to penicillin. And when I select it, so you can either search for an allergy if it's not in this common drug allergies in here. So in here, you're most commonly going to use any medication allergies that you have. And I'm going to add that column, that common allergy. And the next page that shows up is actually just going to ask for a little bit more information. So if you do know, you can choose what kind of reaction this patient has, when the onset date was. You can free text in a reaction as well. However, you don't necessarily have to complete this information if you don't know the specifics. You can still add it without that. And when I press add, it's going to come here. Now you'll see, you can see that I kind of had, and I'm just going to spotlight this little area here. You can see that now this allergy is added. Now I've completed them, and what I'm going to do is I'm going to say I'm done with allergies, and that has now become on the record as an allergy that they have. And the next screen it's going to ask you for, again, remembering that this is a patient that we haven't prescribed for in ERX before, is they're going to ask you to set a default patient pharmacy information. So now this is usually a patient will know they usually go to a specific pharmacy close to their home, and you can search for it, and you can select it. You can search with a number of different fields here. I'm just going to use a zip code and press find. One thing you will notice when the results come up, there is a lot of results because, as Mary mentioned, there's a number of pharmacies in their system, and you can choose here and find which ones they are. A couple of things of note are these little symbols next to pharmacy names, which will let you easily see specifically which pharmacies accept EPCS prescriptions or require additional information, whether they're retail or mail order. They accept electronic prescriptions, etc. And I'm going to say that this is their pharmacy. Now, keeping in mind, anytime you do write a prescription, you do have the ability to change the pharmacy if they've decided they're going maybe to one that's closer to the school on their way home. You have the flexibility to do that, and so that's just the default, so you can add that in. Now, the first method I want to show you of prescribing is the one-click method. So the easy method for if you've already written a prescription and you've added it to your favorites list. So here, let me just spotlight it here again. Here in this section for prescribe a medication, we've got favorites, and I can select the drop down next to it and see these. So these are saving the signature line, so they're usually commonly prescribed, and the dosages and the frequencies are pretty standard, so we've added them. And so I'm going to first prescribe a legend substance, and then I'm actually going to choose one that I know is going to have interaction with what we've set up as their allergy, so I can show you how it does those checks. So if I select this, now I know that I'm prescribing amoxicillin 250 milligram capsule, and it's taken twice a day. And if I press use, it's going to open up this confirm prescription warning window. Now, because this has a warning, it's telling me what the allergy alert is, and keeping in mind that these kind of medication or interaction alerts aren't specifically only related to allergies. So if you've indicated, you know, they could be based on maybe if you've indicated they have high blood pressure, it can have alerts based that. Sometimes if you've indicated for a female, if she's pregnant, you might get an alert relating to that kind of alert. So there's a number of different kinds of alerts that Dr. First and this Arcopia engine does alert you to. So I'm seeing the alert, and I'm going to say that I'm going to cancel, and I'm going to change what I'm prescribing. So I'm going to choose now another antibiotic that should not show up an allergy alert. So in this case I have clindamycin, and again it's a 150 milligram capsule, and it's telling me what my sig line is right here as well. So now when I press use, as long as there's no errors, it's going to automatically drop down to my pending prescriptions for this patient. So at this point, we've written up the prescription, but we haven't actually sent it to the pharmacy. So you can see here, you can see the serial number, you can see this is the doctor, these are the initials for Mary Jones, who I'm logged in as, the patient name, and then it has your drug and your sig line. If at any point you kind of want to see what the, you know, double check and see what it looks like, if you click on this little status of pending, it'll actually pull up a sample of what the actual prescription looks like, and you can review it here as well. And I'm going to press back. So that's a really easy one-click method of prescribing. So now what I'm actually going to go in and do is show you the longer method and show you that using the example of a controlled substance. So a controlled substance, I know we could possibly use, say, Vicodin, and I'm going to, I just typed it in here, and I'll spotlight it again, in the prescribe a medication in the name field. I'm going to go find it. So I can also search by category if I want to, but I'm going to type in the name and find. And you'll notice I get a result list here, and it's showing me the different versions we have set up that you can prescribe. If you want to use the generic name, I can click on this and it'll give me the generic one as opposed to the actual Vicodin name here. So I'm going to select the first one as an example, and it's going to bring me to this enter details screen where I'm going to actually set up my dosage and sig line. Now for a prescription that's not saved on, if it's saved on your favorites, so I actually have saved this on my favorites, it shows the sig line here that I did selected, but at any time you can come in and modify how many you're taking. You can change this here. So maybe I'm saying they take 2 tablets once a day instead, and I'm going to come in here and update that as directed, and again you're going to have some additional information that Arcopia helps with, like a standard maximum daily dose. That you can do a dosage calendar that'll help you in prescribing, and then you can select your duration and change it, and that's going to automatically update. So actually I'll change it to 2 days here, so you can see that it automatically updates this quantity line with how many tablets you should be getting based on what you put in your sig line there. You know, in this case for a controlled substance, it's saying no, there's no refill available for this. And then just information if you have directions to a pharmacist, if you want to indicate there that you don't fill this prescription before tomorrow, if you're doing it in advance. And then again, directions to the patient is actually just an add-on to this SIG line, so it will show up underneath your SIG line. And I've just typed in with food. So this is showing up because I have this saved in my favorites as well, and it's remembering how I like to prescribe this one. And then you have a space for comments, for internal comments, and I'm going to press continue here. It's going to preview the prescription here, so I can view it. From here, I can add anyone to favorites, or I'm just going to go back here and show you that the stop medication here is based on when we've said, the duration, so it's automatically doing 3 days from now, or 2 days from now, which is the 30th. And then you can see the pharmacy it is going to as well. You can go back and modify anything if you need to, but I'm going to press OK. And it is also now going to be added to your pending prescriptions for this patient. One thing I want to point out is on the top here on the orange bar. So this all the information that we've entered, so whether when we're entering a prescription, when we're entering allergies, when we're prescribing, it's all actually done within this one scrolling screen. So if you want to quickly access it over here, you can see, the pending RX. That shows me there's 2 pending prescriptions for this patient. And if I want to quickly jump to that area without scrolling, I can just click on it and it takes me to that area in the Arcopia window. So from here, very simple to now we've written up the prescriptions, because sometimes if you do more than one, and then you'll notice the only one checked is this non-controlled substance prescription that we wrote up by default, so because it knows it can be sent with just a signature password. So what the signature password is, it's set up for the provider, for a prescriber, so a licensed doctor, to send the prescription to the pharmacy. Right now we've written it up, and now when we're actually sending this one, I can click on the signature password line, which just to highlight for you is right here, signature password about halfway down through. And this will be unique for obviously for each prescriber, and they won't share it. And from here, I'm going to press the send button. Now, a couple of different options. You can send and print, which just means I'm going to send it to the pharmacy, and I'm going to have a printout that is labeled with copies that I can give to the patient. You can actually print it without sending. So in the case where you don't necessarily want to send it electronically, you can still you can still print it for dispensing for the patient if they prefer to take a paper copy with them. In some cases that might be the case. And then signing without sending means you're signing it at this point, but I'm not sending it yet. And later you'll actually send the prescription at a later time, and you'll come back in and press the send button. So I'm going to say send here. And you'll notice that it is now our medications area has that clindamycin. So there's no errors. I put in my SIG password, which was correct. It was verified, and it was sent. And now it's become a medication because I've sent that prescription. It's no longer pending. It has been sent to the pharmacy. You can also see that from up here where it says the prescription was signed and sent to this pharmacy for this patient. And now the e-prescribing part, so this is the last thing we want to touch on here, is the actual process of going through e-prescribing controlled substances. So as we've mentioned, there is additional authentication that's required. So I'm going to select this. I still have to put in my signature password, but this time when I press the send button, it is actually going to take me to an additional window for the controlled substance prescription signing. You'll notice information, we've got the patient information, we've got the prescriber, we can see the controlled substance. So here, so this is the additional authentication window. I have to select which one I am sending, because you could have a number for this patient. And I'm going to choose which token I am using. And so I have just a soft token, and I'm going to select that. You know it. So your signing passphrase, as Mary mentioned, is something you know. So that is going to be different from your signature password. So it's required to be different as the second level of authentication, because it's only used when you're doing your ERX. Now the PIN from your token is entered here. And in this case, I'm using my soft token, and I still have about 20 seconds left, so I should have enough time. If I want to show the text to make sure I've entered the PIN code correctly, remembering it changes every 30 seconds, I can see that I have, and I can press the sign and send. And as long as it authorizes and all the information I entered was verified with the right passphrase and the right token, the token was valid, then it's going to go through with no problems, and I'll say again here, this prescription was sent to the pharmacy. And that is how easy it is to prescribe within ERX. So now, you know, we entered a bunch of information on here, and once I'm done and I'm happy, I can just exit out of this window, and you'll notice it's now going to be updating. It's going to be updating Axiom. So this pop-up question, you can enter yes if you want to print a copy of the prescriptions that you just sent for the patient, keeping in mind they will print with, again, it says a copy, it'll say not for dispensing because you do not want to be printing that. I'm not going to print it at this time. But one thing to note is if you print a controlled substance prescription can only be sent or printed once. So if you chose the option to print it without sending, you're not going to be able to send it electronically because it's going to print the if you chose to print it from within ERX before you sent it, so it's not a copy anymore, you only have the ability to do it once. So if you printed it, then that is going to be a paper controlled substance prescription versus an electronic one, and you won't be able to send the electronic one. And that is, now you can see that the medications have updated and the alerts have also updated here. We added penicillins in. And now I'm actually going to go back to the PowerPoint and pass it back over to Karina. So bear with me one moment. And I just have to close.
Okay, thank you. Thank you, Kaljit. Thank you to both Kaljit and Mary. And this sums up the presentation portion of our webinar today. And now we're going to pause to answer some of your questions. We have had quite a few that have come in over the last little bit. And there's a couple that we'd like to start with. Seeing as that we've just finished the demo with Kaljit, there's a question that has come through, and I'm going to read it out for Kaljit. Basically, the question is, what information gets updated between Axiom and the ERX module?
Sorry, I was talking without unmuting myself. I was answering the question. Can you hear me now, Karina? Okay, sorry about that. So the pieces of information that come back from go back between ERX and Axiom are the medications, the allergies, and the problems. So problem codes if you're using SNOMED. So those are currently the only ones, the ICD codes that will come back and forth. So that means if you add a medication in Axiom, it will bring it over into Dr. First, or Copia, but it will ask you to match it with one that's in their database so you have the right accurate information, and they do actually match, so it'll do the interactions correctly.
Okay. Thank you, Kaljit. Sorry about that. I think there was a bit of a pause just because of muting issue, but I think we've got that sorted out now. So I have another question here. I'm going to ask Mary to answer this question, if you would, Mary. The question is, can I send an electronic prescription for a controlled substance to an out-of-state pharmacy? I'll let Mary answer that question.
Okay, and yes, you can do that because it is legal in all 50 states. You only just need to make sure that the pharmacy that you're sending to does accept EPCS prescriptions, and you can see, Kuljit showed you how you can see that with the code C in Axiom ERX. And actually, this is in the pediatric space really proved a very positive thing. For example, if you're sending, if you need to get Ritalin to a college student and they're out of town, it's far safer to send the script, EPCS script, to the pharmacy and have the patient pick it up rather than having the mail carry that that controlled substance to the patient out of state. So.
Okay. Okay. Thank you, Mary. Thanks for answering that. There's a question here that came in about the OTP token. I believe somebody had just wanted to know how do you get the OTP token again. I'm wondering maybe if you could just share that with the rest of the audience, if you can, Mary.
Absolutely. So we actually, once a provider, once you told us, or Exan in this case, that a certain provider wants to sign up for EPCS, between the two organizations, we get the hard token sent to usually the practice, and in some cases it can be sent other places, but usually in your case this is sent to the practice, and so an administrator will give you that token. You can use a soft token as well, and you can download that at no cost on your phone at any time. And someone also asked the question, I saw, whether or not you have to have two or can only use one. We actually recommend that you use both, and but you only do have to use one, and you can use either a hard token or a soft token. But the reason that we recommend that you have two is that it's all too easy, especially if that's a soft token, to accidentally trade in your phone, and then you've lost that one factor of authentication, and you have nothing else to spawn or to prove that you are who you say you are. So in that case, you'd actually have to start the process again, which is not what you want. Wherein if you had two, you can actually use the second token to re-authenticate the new soft token on your new phone, for example, or vice versa if you had it on your phone and lost your hard token. So just want to take both of those at once.
Okay. Thank you. Thank you, Mary. We're just vetting through some of the questions that we have here. By the way, thank you all for sending these in. We have received several of them, so we're trying to go through as many as we can. I don't know if we're going to be able to get through them all today. If you did ask us a question and we can't get to it today, we do promise to follow up with you via email. There is a question here that has been asked, which is how much setup is required by each institution to set up the favorites. Or can training be set up without sending this? Sorry, the question was, can training be set up without sending this to an actual pharmacy? That was the question. I'll let Kuljit answer that one, and then we'll go to the previous one that I just asked.
Thanks, Karina. Can you hear me this time? Yeah. So in regards to that, yes, we do allow a testing database for that. So just as I showed an example, obviously I am not a licensed physician and I cannot prescribe medications. So I did it in a demo database that does not send to a pharmacy. So when you are ready to implement, our awesome ERX team will help you set it up in Train with a test database that doesn't actually send to pharmacies.
Okay, thanks, Kuljit. So now I will address the question that came in previously as well, and Mary, maybe I'll get you to answer this one. The question was, how much setup is required by each institution to set up the favorites?
So actually, the institution doesn't specifically have to do something themselves. You can say that you would want to set them up kind of a certain way, but the intention of the favorites is that someone would prescribe something and then they would just, after they prescribe it, add it to their favorites list. There's a button right beside it that says add to favorites, and then that gets added to the practice favorites list. as well, so that everyone in the practice can see that. So you don't really have to prepare that in advance.
Okay, thank you, Mary. We are running out of time, so we have time for one more question. I'll get Kuljit to answer this one. The question is, what is the max number of faculty per school using EPCS tokens? And I'll let Kuljit answer that one.
Hi, so that question, if you're asking if there's a maximum number you can set up, there is no maximum. Each provider that needs to use EPCS is required to register, and there's a fee, so the school does indicate or decide how many registers, how many faculty they want using it, but there is no limit to how many can. In regards to if you're asking about how many of our clients do, so it varies per client. Some clients have only set up a few EPCS providers that send the EPCS prescriptions, and many have probably have 10 plus up to 50 providers, and sometimes even more, that anyone who is able to send them, it does get set up. So it really does just vary by school. But there is no limit to how many you can set up.
Okay, thank you, Kuljit. Well, we are coming up to the top of the hour. We're hoping to keep this under an hour for everybody, so we do appreciate all your questions. As I did mention, we are going to get to them. If we haven't answered them live for you today, we will get to you and follow up with you via email and or another means of communication, whether that's phone. After today's webinar. So we do thank you all for all your wonderful questions, and we'll just finish up the webinar. If we could go to the next slide, and I'll get Kuljit to advance to the next slide. Thank you. Just a quick reminder that for taking the time to join us today, we do have a gift for you all. We will be emailing you a link to download a copy of Dr. First's white paper entitled The Evolving EPCS Landscape, a prescription for stopping opioid abuse. And in the, can't hear me at all. Lord. Okay, sorry, someone just came in and said they couldn't hear me. So maybe if I could just get a show of hands, if everyone can hear me, if you wouldn't mind just putting up your hands. Okay, yeah, you can hear me. It must have been someone else. I apologize, everyone. Someone just opened the door and said that they couldn't hear me. So it looks like you can hear me, so thank you all. We're just going to wrap up here. As I mentioned, we're going to be sending you the copy of the white paper, and we'll also email a link to download of a recording of today's webinar session as well. And next slide, as we also invite you to share your comments or feedback on today's webinar. We'll also included in the email will be a link to a quick survey. Please tell us what you thought. Let us know if you have any feedback on today's session, as well if you have additional ideas on future webinar topics. That's always helpful as well. And we'd like to know what you want to know. If there's a topic out there that is of interest to you that, that you think that we could deliver, please let us know. So look for an email in your inbox shortly after today's session, no later than tomorrow, with these details. And once again, on behalf of our presenters, Kuljit and Mary, I sincerely thank you for joining us on today's webinar. We hope you found the webinar not only informative, but interesting and useful as well. And for more information about Axiom ERX, please send us an email to axiom_sales@xansoftware.com. And thanks again, everybody, and please enjoy the rest of your day.